So, first question is, why did you want to become a doctor? How did you choose your field of medicine? All right. So, it took me a while to decide that I wanted to be a doctor. I did think that I would be in some sort of health related profession, almost leaning more towards physiotherapy because I was quite active growing up, had a lot of injuries, and I saw and experienced firsthand the way that they could help me get better. And I figured that that would be something that I would love to be able to do. I always was excited and had a great time when I went into physio, and always saw, for the most part, people leaving happier than when they came in. But what led me to actual medicine was when one of my parents was diagnosed with a complex medical condition, and they were having a lot of difficulty with the patient education and navigating the medical system. So I did what I could to help them throughout their medical journey, and I fell in love with that type of teaching and learning, and that's what really pushed me towards medicine. And that's a really brief summary of what got me towards being a doctor. There's a lot more that went into it, but um, that was definitely the biggest impact. And how did I choose my field of medicine? So throughout medical school, I figured that I would do family medicine. I really enjoyed the flexibility and that you could really do whatever you want, work wherever you want. And that led me to do a longitudinal integrated clerkship is what it's called. And essentially it's when you are finished your first 2 years of medical school, you're done with all the classroom learning, you go out into the hospitals and you get to do that hands-on learning with actual patients, actual doctors, in person. And I did that whole year in Cape Breton, in Sydney, Nova Scotia, and I had a fantastic time out there. And it was out there that I met a otolaryngologist, head and neck surgeon. That's the longest name of any specialty out there. And what it is, if you've heard of an ENT or an ear, nose, throat surgeon, that's the same thing. It's just the longer term for it. I met a physician out in Sydney, and we had such a fantastic time together. Every time we were working together, we built a great rapport. The more and more time I spent with him, the more he would tell me about how much he loved his specialty, how much he had a lot of flexibility and really enjoyed his time both in work and outside of work at home. And that combined with loving to work with my hands and seeing a problem and really fixing it. You cut it out, it's gone. That's what led me to pursue this field of medicine. And I came to it a little bit later than a lot of people. A lot of people seem to know what they want to do before they get into all their clinical training, but the point of doing something different throughout the whole year, whether it's something different every single day or something different every few weeks, is to get exposure to things that you might not have thought of that you would see yourself doing for the rest of your life.